Welcome to Social Security Post, your go-to place for simplifying the most important updates that affect seniors and families living on fixed incomes. Today, we're diving into a major change, new rules that are reshaping how Medicaid works across the United States. These updates are significant. They impact millions of Americans, and we understand how confusing and stressful changes in law can be. But you're not alone. We're here to walk you through what's changing, who's affected, and what you need to look out for over the next year. If you're unsure how these new rules might apply to you or a loved one, leave a comment below. I personally read each one and will do my best to reply to help you understand what's going on. And before we jump into the details, please take a second to subscribe and tap the like button. That way, you won't miss any future updates that could affect your healthcare or financial well-being. Now, let's get started. Medicaid is one of the largest healthcare programs in America, serving approximately 72 million people. It offers medical coverage for low-income individuals, families with children, seniors, and people with disabilities. For decades, it's been a critical safety net, paying for doctor visits, hospital stays, prescriptions, and even long-term care. Unlike private insurance or Medicare, Medicaid coverage adjusts based on income and household status. That's why any rule changes can send shockwaves through millions of households trying to maintain their health and stability. A new federal law, sometimes referred to as the Big Beautiful Bill, was just passed by Congress and signed into law. This bill includes major revisions to Medicaid, and it's not theoretical. These changes are official and taking effect. While not everyone on Medicaid will feel the impact, millions will. So if you or someone in your family relies on Medicaid, it's important to understand what's happening and what to do next. Here's the breakdown. The new law was officially signed on July 4th, 2025, as part of a broader federal budget package. One section in particular introduces work requirements for Medicaid recipients. That term, work requirements, can sound scary or confusing, but let's explain what it really means in simple terms. The government is now requiring a certain group of Medicaid recipients to complete work-related activities each week in order to maintain coverage. But not everyone on Medicaid will be affected. We'll explain who is and who isn't impacted in just a moment. What's key to understand is, this isn't just talk or rumor. The law is signed. It's happening. Now. While it's normal to feel worried about something unfamiliar, your best defense is understanding the facts, so you're prepared and don't get caught off guard. Who does this apply to? Out of the 72 million people currently covered by Medicaid, experts estimate that between 5 million and 20 million individuals may be affected by the new rule. That's a wide range, but the reason is simple. Each state has different enrollment patterns, and not all experts agree on the projections. The initial focus is on a specific group, able-bodied adults without dependents. In plain English, that means adults who are physically capable of working and who do not have young children or other dependents living in their household. Seniors aged 65 and older are completely exempt. So, if you or a loved one is in that age group, there's no need to worry about these work rules. Your Medicaid coverage will continue as usual. But for people between the ages of 18 and 64, without young dependents and who are able-bodied, you'll want to pay close attention to upcoming updates from your state. What exactly counts as work? If you fall into the affected group, the new rule says you must complete at least 20 hours per week of qualifying activity. That's 80 hours per month. But it's not just about traditional jobs. The law allows several activities to count toward the requirement. Volunteering community service job training programs, attending approved education classes. This flexibility is critical. Many Medicaid enrollees face obstacles to regular employment, like transportation issues, caregiving duties, or health challenges. So, allowing non-employment activities to count helps protect access to coverage. Still, it's very important not to ignore this requirement. If you're in the target group and don't meet the 80-hour monthly minimum, you could lose your Medicaid benefits. Make sure you understand what qualifies in your state, keep detailed records of your hours, and stay in touch with your caseworker during the transition. What about people with disabilities or pregnant women? Good news, they're protected. If you're disabled, you're automatically exempt, even if you're under 65. The law acknowledges that not everyone is physically capable of meeting a work requirement. Pregnant women are also exempt and will continue to qualify for Medicaid without needing to meet any new rules. And as we said earlier, if you're 65 or older, you are fully exempt as well. So again, the law is targeting a specific group: adults aged 18 to 64 who are able-bodied and have no dependents. If that's not you, these rules likely won't apply. But it's still smart to read all notices from your state, just to stay informed. One more important change: how dependents are defined. There's a new definition of dependent in this law. In the past, any child under 18 was considered a dependent. So if you were caring for a child, you were exempt from work requirements. But under the new rule, only children aged 13 and younger count as dependents. So if you're a 42-year-old caring for a 14-year-old, you now must meet the 20-hour weekly rule, even though your teen is still clearly a child in everyday life. This is a big shift and could catch many families off guard. It may feel unfair, but it's part of the official federal rule now. So if you're caring for teenagers, please plan ahead. When will these rules go into effect? The federal law says all states must implement these changes by the end of 2026. That might seem far away, but in terms of government timelines, it's really not. And because Medicaid is managed jointly by federal and state governments, each state will create its own rollout schedule. Some states might start within a few months. Others may wait until the final deadline in late 2026. So you cannot assume your state will be slow. Always check official letters, news reports, and announcements from your Medicaid office. States are required to notify you, but if your contact info is out of date or you miss the message, you could lose benefits without realizing it. Be proactive. Make sure your current address, phone number, and email are up to date with your local Medicaid office. The sooner you know what your state plans to do, the more time you'll have to meet the requirements or apply for an exemption if you qualify. Why do these rules vary by state? Even though Medicaid is funded mostly by the federal government, each state administers the program on a day-to-day level. So when a new federal law like this one passes, Washington says, here's the rule. Every state must follow it, but you decide how and when. That's why you might see the new rules enforced in Florida this year, but not in Oregon until 2026. Same law, different timelines. That's how Medicaid has always worked. If you're enrolled in Medicaid and are between the ages of 18 and 64 and do not have dependents under age 14, then these new work requirements are something you'll want to monitor closely. But if you're a senior, pregnant, or disabled, you are protected from these new changes. Still, it's crucial to keep checking your mailbox, answer official phone calls, and stay in regular contact with your Medicaid caseworker. We understand this can be overwhelming, especially with the rules rolling out differently in each state. But staying informed is the best way to protect your healthcare coverage. Keep following Social Security Post for clear updates on everything from Medicaid to Social Security to retirement. If you have any questions about these changes, please leave a comment. I personally reply to help you understand what's going on. And don't forget to hit like and subscribe so you never miss another important update. Take care, stay informed, and we'll see you in the next video.